If I only have one wish this Christmas, it would be to hear the Medicare for the Lazy Man podcast. A Medicare podcast that barks up the right tree every time. And now, practicing bird calls under the spreading chestnut tree, it's Medicare expert Doug Jones.
Oh boy, it's another exciting episode of the Medicare for the Lazy Man podcast. Thank you for joining us, ladies and gentlemen. We are so excited to bring you another episode that I can barely contain myself. This is going to be a moderately interesting one, I think, but it's always, as always, inspired by the book Medicare for the Lazy Man 2022. And of course, you can get that book at Amazon.com in any one of four editions, or you can go to BarnesandNoble.com and you can get a sweet little paperback edition that has colorful interior illustrations. Randy helped me with some of those illustrations, and they look magnificent. That would be your choices. If you go to Amazon, you'll probably get a little bit cheaper price. You'll get your choice of either the Kindle version, the Audible version, the paperback version, or the hardcover version. I like the hardcover version. It's a little more expensive, but it looks so impressive on my bookshelf next to me here. And on the spine of the book, it says Medicare for the Lazy Man 2022, Douglas B. Jones. I never get tired of looking at that. In fact, I gave two of them to our local library, and I've got a check over there. I'm going to send in a spy and see if they have actually put them in the card catalog. I'm assuming they have a card catalog and not some kind of computerized thing that we'll never be able to figure out. But I'd like to make sure that my books are out on the shelf for people to be borrowing and to be learning about Medicare from. Because what I do is, after they read the book, I help the people devise the plan that's going to suit them the best for dealing with Medicare. And then I help them execute that plan by selling them the very competitively priced insurance policies that will round out their protection against medical expenses. So once you've pulled the trigger on those things, and once I've been able to successfully help you prepare for and deal with your entry into Medicare, you'll rarely ever have to think about Medicare ever again. And that's the goal. Set it and forget it. That would be I may put that on the cover of the next book. So anyway, I'm going to call Randy in to join us here because I've got a burning question, a question that's been on my mind, and I haven't expressed it lately. So I want to find out. We had a little episode a few episodes ago. We had a little, we touched on a subject that seemed to set him off. It concerned him a little bit. Randy, are you with us? I can hear you fine. Now. Welcome to the podcast.
Hello. Can you hear me now?
I'm glad to have you with us.
It's actually an advertisement for what cell company was it that you say, can you hear me now?
Oh, yeah. A guy walking around with one finger stuck in his ear. Can you hear me now? Well, anyway, I had a question for you a few episodes ago.
Okay.
I quoted somebody as making a statement, and your face changed. Like, how can that be? How can that's impossible. You remember what the subject was?
Well, it probably had something to do with insurance and probably had something to do with Advantage plan.
No,
I lost. What?
My sister, Drew's mother and father were here visiting from Canada. And they're just so excited to be here in Arizona because Canada was just a god-awful nightmare, and weather-wise, and politically. And so basically, we took them all kinds of places in and around Cave Creek and Scottsdale. And one of the places we took them the last day they were here was the Mountain View Pub. And we were sitting outside basking in the sun. And my brother-in-law, Drew's father, ordered a Guinness. And the waitress was somebody I asked if you had known. She's very petite, blonde hair. And you said, yes, I know exactly who she is. And she made the statement to us that the little tiny Mountain View pub that sits on a cliff overlooking a shopping center, she said the Mountain View pub sells more Guinness than any place else in Arizona. And you said, I'm going to get to the bottom of that.
Yeah. I really have a hard time believing
it's not possible.
I mean, if you look at all the Irish pubs that are available in Scottsdale, Phoenix, and all points south, I can't imagine that being the case. Now, I do have sources that I can figure this out, because I have a good friend of mine that runs the distributorship that would have had to have come out of.
Okay. Well, I'd like to know, because she was so convincing, and on several other elements that she and I discussed, she was right on the money. She was quite the salesman for the Mountain View pub. She was very solicitous and helpful. And when I had a Reuben sandwich and it wasn't up to my normal golden standard, which is the Reuben from Chompy's, she said, I've got to go to Chompy's, the new location, and check it out for myself and see what our competition is up again. Like, how can we improve our product? I thought that was a great attitude for a waitress to have.
Yeah.
So
I think they're going to put in a BYOR. Bring your own Reuben.
Well, I would do that. I'd stop at Chompy's and, take a carry out. I don't know if they do carry out, but I imagine if you pay them enough money, they'll do anything.
They do. Yeah, they can do carry outs in Chompy's.
Oh, of course, because of the plandemic, as my daughter calls it.
Yeah. You could even get a little plate of those pickles you so love.
I like the pickles only with the Reuben. So I'm going to have to take the pickles with me to the Mountain View pub to allow the waitress to have a bite of my Reuben. And this whole thing is starting to sound a little weird now, isn't it? But we do want to know, are they really good at selling Guinness? Are they selling as much or more Guinness than any other outlet in Arizona? That's hard. I've seen a lot of hard drinking Arizonans in various places.
I will have to find that. I mean, I can find that out, and I will definitely put out my, I used to be a private investigator. You know that, right?
I didn't know that, but I'm happy to hear it, because I got a few other things I want checked out too.
Yeah. In one of my past lives, a good friend of mine, Frank, good friend of mine, Frank, back in Omaha.
I've heard about Frank. I've never met him, though. Never had the pleasure.
Well, someday I hope. He actually, he was a retired cop. And then when I met him at the bank where I worked, he was the head of security. And one of his little side gigs was he ran a detective agency. He was a licensed private investigator. So through Frank, I got my license. I was a licensed private investigator. And so when I say I can find something out, I can find something out.
I had no idea. That's a side of your history I had not explored yet. So I'd like to talk about that, because my favorite TV show when I was a kid was 77 Sunset Strip. And
I love all that stuff.
Every time my parents would say, or the family friends would say, what are you going to be when you grow up? If it wasn't a cowboy, if it wasn't an engineer, it was going to be a private detective. And they all looked at me like, you're crazy, kid. You'll grow up and realize those people are the scum of the earth someday, but you're not the scum of the earth. So obviously my parents' friends were missing something about private detectives.
Well, you know what I wanted to be when I grew up?
What's that?
A pilot.
Yeah. And then you met Frank and you got your detective.
I needed to be a private investigator at that point. But so when I got like in my 20s, I think, I can't fly a plane, but I can jump out of one. So I actually and as you know, I actually, like you did, I got my paratrooper's license, or whatever they call that.
Yeah.
Your license to jump out of planes. And of course, the biggest joke everybody always says is, why would you want to jump out of a perfectly good plane?
You get tired of hearing that joke, don't you?
You do. And then the other one is, it's not the fall that kills you. It's the abrupt stop.
Well, we're kind of guilty of using that joke on this podcast more than once. So I can't apologize for that. I'm hoping somebody in the audience still thinks it's entertaining, though. Hey, listen, we got some Medicare stuff to talk about. So we do. Let's get after it. This is a longer than average article, and I'm hoping that it just flies right by or proves to be interesting. If not, I'm going to bail out in the middle of it because our audience has really been listening to you. You're closing when you read your list of things. You're looking up at the wall. I can see you've got a list there. And when you ask them for contributions, they have been helping. So they have actually filled up the Medicare for the Lazy Man mailbag. So I'm pretty happy about that. We'll have a mailbag episode very, very soon. Anyway, so this article I ran across and I wondered if it might have some interest for the audience. And it is entitled, "Why Won't More Older Americans Get Their COVID Booster?" And it's by a woman named Liz Sasbo. And Randy's got an opinion already. I haven't even started reading the article. He's got an opinion. What is it, Randy?
Well, I probably have told you that I stuck with the old J&J.
Yep.
And I got the J&J original. I got the J&J booster. And now they're saying now J&J is off the market because they say it's going to rot your brain and your head's going to fall off. So anyway, you can't even get a J&J anymore. And then, but the other stuff, and I'm not going to name names, but my personal physician, when back in the very beginnings of the pandemic,
yep,
he actually was all excited because he was like first in line or one of the first wave that could get the
sure.
first deal.
Booster or regular? Regular or
way back in the first days of getting regular,
Okay.
And I forget what it was. What was the other two?
Moderna. I'm a Moderna man myself.
And then there was one other.
There was one other one that was only one injection.
That was the J&J.
Oh, okay. Well, there's another one that was only 2 injections in. I'll have to think about that.
Moderna and something else.
Pfizer and
Moderna. So I don't know which one my doc got, but he was all excited. So he went and got whichever one it was. And within days, I mean, this guy, I got to tell you, this guy is a young man, works out, could run 45 miles with a 60-pound backpack. He's really cut, really in shape. And he took whichever one it was, and I don't want to get sued, but whichever one it was, he took it. And within 3 days, he was in the hospital.
Ooh.
And he, because he's a doc, he had access to other stuff that other people don't. And down in the deep, dark, distant crevices of the documentation, for whichever one it was, it said one of the side effects could be appendicitis.
Oh,
so he was literally in the hospital in an emergency situation, getting his appendix ripped out 2 days after he took whichever one this was. Boy. And he said, I'm not taking any more. He said they had a chance to kill me once and they missed it.
Yeah. Well, I never heard about the appendicitis connection. I know that several of my relatives, my first degree relatives, my father had emergency appendicitis during, as ironically, the Germans were trying to kill him, but his own appendix tried to kill him at the same time.
Yeah.
And he survived both of them. And one of my sisters, or both, and my grandfather, my mother's father, they all had appendicitis. And I skipped that. I missed that. I don't know how, but so I had Moderna, first 2 shots in February and March of 2021. And then after shot number 2, I actually came down with the COVID symptoms for about, I'm guessing, 24 hours. It was an excuse to take a long nap without being bothered by anybody. So after that, I felt just fine, but I never have gotten a booster. And in spite of all the politicians threatening, various horrible things would happen to us without getting the boosters, and that life would be beautiful and sweetness and light and flowers and candy if we did get the booster. In spite of that, all of that, I didn't get a booster. My wife didn't get a booster. My daughter and her husband didn't get boosters. And here's the article asking the question, why won't more older Americans get their COVID booster? Even as top U.S. health officials say it's time America learns to live with the coronavirus, a chorus of leading researchers says the faulty messaging on booster shots has left millions of older people at serious risk. Now, this article was dated May of 2022, May 12th. So And it's printed in the Kaiser Health News, which people tell me is a fairly reliable source of information about medical stuff. So let's see what this article has to say. Approximately 1 in 3 Americans aged 65 and older who completed their initial vaccination round still have not received a first booster shot, according to the CDC. Those are the people that insist that everybody has to wear a mask because Fauci's in charge. So right away, their advice is suspect as far as I'm concerned. The numbers have dismayed researchers who note that this age group continues to be at the highest risk for serious illness and death from COVID-19. The New York Times and this publication are looking into whether Americans have enough resources and help as they age. People aged 65 and older account for 75% of U.S. COVID deaths, and some risk persists even for seniors, the term I hate, who have completed an initial 2-dose series of the Moderna or the Pfizer vaccine, or gotten 1 dose of the Johnson & Johnson vaccine. They say a serious, some risk, they say some risk persists even if you had all of those vaccinations. Among older people who died of COVID in January, 31% had completed a first vaccination round but had not been boosted, according to an analysis of CDC data. Okay, well, first of all, I think we know that a lot of shenanigans went on when they were compiling statistics about cause of death for people who died in hospitals. So I'm really taking all of this with a grain of salt. Anything that comes out of the CDC, they have lost my lockstep allegiance. Anyway, reading on, the failure to boost more of this group has resulted in a loss of tens of thousands of lives, says a doctor who is founder and director of the Scripps Research Translational Institute. The booster program has been botched from day one, this guy said. This is one of the most important issues for the American panic. He said pandemic. I say it's a panic or a plandemic, and it has been mismanaged. If the CDC would say this could save your life, he added, that would help a lot. Although the initial 1 or 2 dose vaccination course is effective at preventing hospitalization and death, immunity fades over time. Boosters, which renew that protection, are especially important for older people now that COVID cases are rising again. I'm not even sure I believe that. More transmissible Omicron subvariants are proliferating, and Americans are dropping their masks. The masks never did squat anyway. I think we all know that. That masking thing was just a ruse for people in power to force everyone to kowtow to them. So to go on with this article, some older people who were prioritized for initial vaccination in January of 2021 are now more than a year from their last shot. According to adding to the confusion, the CDC defines fully vaccinated as people who have completed an initial 1 or 2 dose, even though a first booster is considered crucial to extending that COVID immunity. Numerous studies have confirmed that the first booster shot is a critical weapon against COVID. A study of older veterans published in April found that those who received a 3rd dose of mRNA vaccine were as much as 79% less likely to die from COVID as those who received only 2 shots. A central question for scientists championing boosters is why rates have stalled among people 65 and older. Surveys have found politics and misinformation play a role in vaccine hesitancy in the population at large, but that's not been the case among older people who have the highest initial vaccination rate of any age group. More than 90% of older Americans had completed an initial 1 or 2 dose as of May 8th, 2022. By contrast, 69% of those vaccinated older Americans have gotten their first booster. So 90% got the original 2 shots, 1 or 2 shots, and only 69% have gotten their first booster. Overall, fewer than half of the eligible Americans of all ages have received a booster. The discrepancy for seniors is likely due to changes in the way the feds have distributed vaccines. And although the Biden administration coordinated vaccine delivery to nursing homes, football stadiums, and other targeted venues early last year, the federal government has played a far less central role in delivering boosters. Today, nursing homes are largely responsible for boosting their residents, relying on pharmacies they traditionally hire to administer flu shots. Outside of nursing homes, most people generally find their own boosters either through clinics, local pharmacies, or primary care providers. So Dr. Thomas Frieden, a former CDC director, I hope he didn't go to the Fauci School of CDC Directing. He says that in theory, shifting responsibility for ongoing COVID immunization from government-sponsored clinics to individual providers might seem logical, given the privatization design of U.S. healthcare. In reality, that approach is not working because our primary healthcare system is life-threateningly anemic and not set up to readily take on public health mission. Most healthcare providers don't have the technology to securely track which patients have been vaccinated and to schedule follow-up shots, nor are there financial incentives for doctors to get their patients vaccinated and boosted. Even before the panic, 28% of Americans did not have a regular source of medical care. This Grabowski guy says that nursing homes in particular need more support. Although fewer than 1% of Americans live in nursing homes or assisted living facilities, they represent more than 20% of COVID deaths. Well, we all know that COVID is going to hit everybody harder when they're older or obese or have there's a term for have an additional secondary type of complication. So anyway, he would like the Biden administration to resume coordinating booster delivery at nursing homes through mass vaccination efforts. I would have these centralized clinics go back to get residents and staff boosted all at once. That strikes me as a no-brainer. The Biden administration has touted its continuing efforts to vaccinate older people. For example, the Centers for Medicare and Medicaid Services, they still haven't figured out what the spelling of their acronym should be. It's 4 words, CMMS, but they drop one M, so they say it's CMS. Learn how to spell, people. So the Centers for Medicare and Medicaid Services has sent quality improvement teams to advise nursing homes with low vaccination rates. The Medicare program has mailed letters to all 63 million beneficiaries to encourage them to get boosters and has sent millions of emails and text message reminders. Still, many health advocates agree that the country has lost the momentum that it had during the first months of the COVID vaccination campaign. There doesn't seem to be the urgency that we saw with the initial shots. Some researchers attribute the slowdown to the initial disagreement among health leaders over the value of boosters, followed by a staggered rollout. Boosters were approved in stages for different age groups without the fanfare that typically comes with a single major policy change. In addition, although advertisements for vaccines seem to be everywhere a year ago, government agencies have been less vocal about encouraging boosters. I feel like we were getting hit over the head originally and all roads led to vaccines. Now you have to find your own way, said this Grabowski. For many older people, the barriers that can make private health care difficult to access in non-panic times also exist for boosters. For example, many seniors prefer to walk in to receive a vaccination, pardon me, ladies and gentlemen, without an appointment or to make an appointment by phone, even as pharmacies increasingly turn to online-only scheduling that requires customers to navigate a multi-layered system. Some seniors, some retardos. Why don't we just, instead of senior, let's call them retardos. Some seniors also lack ready transportation, a sometimes towering obstacle in rural areas where health clinics can be 20 to 30 miles apart. If people have to take 2 buses or take time off from work or caregiving for their family, people are less likely to be vaccinated. Here we have a Dr. Latasha Perkins, a family physician in Washington, D.C. She says she has worked hard to persuade her family in Mississippi to get vaccinated. Her grandmother has agreed to get her first shots in the fall, just as the CDC has approved boosters for all adults. We finally got to a place where we got people to get 2 shots, and then we said, oh, by the way, you need a third one, said Perkins. That was a jarring event for a lot of communities. they would say, you convinced me to buy in, and now you're saying that 2 shots aren't good enough. Although national leadership is important, Perkins said local connections can be more powerful. Perkins has given talks about vaccines at her church. Congregants are more likely to trust her medical advice, she said, because she's a tithing member who they see every Sunday. Some communities have done a better job of overcoming reluctance than others. Minnesota has a boosted rate of 83% of vaccinated residents aged 65 or older, a larger share than any other state. Minnesota's Dakota County has boosted a greater percentage of vaccinated people 65 and older than any other U.S. county, with at least 50,000, let's call them retardos, according to a KHN analysis of the data. That's Kaiser Health News. And a woman named Christine Lees, an epidemiologist and a public health supervisor for Dakota County in Minnesota. She says her department has hired an agency to provide booster shots to residents and staffers of nursing homes and assisted living facilities. The health department runs vaccine clinics and at lunchtime and some evenings to accommodate working people. The department drew on money from the feds, their coronavirus aid relief, and some other legislation created funds, and they pulled money from those funds to run their vaccination, their traveling vaccination thing. Community health workers paved the way for vaccine clinics by visiting residents in advance and answering all their questions. Dakota County also used funds from the American. It all comes down to money, folks. You can vaccinate everybody if you're willing to spend enough money. Where do you get the money? You extract it at gunpoint from the taxpayers. So let's see. This guy at Scripps says it's not too late for federal leaders to look at what's working and what's not working to relaunch their booster effort. It will be hard to reboot now, but an aggressive all-out campaign for seniors, but some call them retardos, whatever it takes, certainly indicated. These people are sitting ducks. I think that might be a little extreme. So are you inspired now to run off and get boosted, Randy? Or maybe you'd rather not share your vaccine status.
No, I'm not.
Okay. Oops, sorry, I brought it up. I don't blame you. I'm right there with you.
When your personal physician ends up in the hospital because of it, and he says, I'm not going there again, they damn near killed me the first time, it leaves a little bit of a bad taste in your mouth for going through the process.
I don't have the data here, but it seems like I've seen studies that show that even the boosters are losing their effectiveness. They're not effective against the new variants coming down the pike. So sure, Joe Biden wants us all to get boosted because that means victory for him. But in reality, if the booster is not effective against the new variants, why would we do that? There is no good reason.
They're preparing for donkeypox.
Well, there you go.
I mean, that's coming.
Yeah, they'll line us all up, make us wear masks, and we'll just have to behave like good little soldiers until the next pandemic arrives.
You got it. So everybody needs to make their own personal decision. All I can say, folks, is investigate it with your eyes open. Don't believe everything you hear. Don't believe everything you read. But make your own decision.
I'm with you there 100%. Let's go home, shall we?
All right. Well, we are coming into the station, but before we sign off, I'm really happy to announce that everybody has been, I've asked people to send Doug email, and they're doing what I've asked, which is great because Doug is in a much better mood when he gets email. I get him into the studio. He's got a smile on his face, and he's just not really grumpy at all.
Well, that's a change.
So anyway, get your emails list out and send something to Doug at dbj@mlmmailbag.com. Even if it's just to say hi, we love hearing from you. Get to Amazon, buy your paperbacks. It's the 2022 version with the green. I was going to say red, but no, it's green.
No, it's green.
It's the green lettering. Get yourself an audio copy of the book. Get yourself a Kindle copy of the book. I think you've said a couple times that Kindle's the most cost effective, right?
$4, $3.80 for one of those.
Yep. So, how can you beat that? So anyway, we are going to sign off for today. You have just spent about 32 and a half minutes with Doug Jones, the anti-insurance guy from Oklahoma. broadcasting from his fortress of solitude, clear up in the mountains. I mean, it's like it's nosebleed area up
Oh
there,
boy.
you know, in Cave Creek, Arizona.
I need
Doug
oxygen.
Jones.
Bye-bye.